Preventive checkup is one of the best things you can do for yourself as a human being. Hello, it's Dr. G once again, and welcome to our talk, Health Talk with Dr. G. So, last week we talked about checking blood pressure, checking weight, and checking lower abdominal circumference, and we expanded on that and we told you how to go about it. So, if you want to see more of that, you can go to my page and then look at it. So today we are focusing on something else. First of all, we are focusing on checking your glycated hemoglobin, and then we are checking also your lipid profile. We are also checking your blood pressure and the risk associated to it. So first of all, when we say glycated hemoglobin, what are we talking about? In other words, you can also call it hemoglobin A1C. So this hemoglobin helps us to know what your blood pressure has been like in the past 3 months. I mean, your blood sugar, what it has been like in the past 3 months, not blood pressure, blood sugar. So when we check this glycated hemoglobin, it is telling us what has been happening in your system, what your sugar level has been doing in your system, how you have been juggling with your blood sugar, and how your system has been fighting to maintain your blood sugar level to the normal standard. So that is what glycated hemoglobin is telling us as a practitioner, and telling us what we can do to help you in your regular day activity. So first of all, when we check this, what is actually glycated hemoglobin? It is hemoglobin that is bound to a glucose. So the higher the glucose in your blood, the higher the level of hemoglobin that is bound to a glucose. So the lower your blood glucose, the lower the level of glycated hemoglobin. So when it's high, we actually have a problem there. But then when it's low, or when it's within the normal range, then we are good. So when we find out that this is a little above the normal range, we can be thinking of something. Can it give us a risk of 10 years? Can it be a risk of 5 years? Can it be a risk of 2 years? So when we check this, we can know whether we are dealing with something that could lead us to acute condition or something that could develop over time. So that's why we do preventive checkup, just to know, just to see a 10 years risk, just to see 5 years risk, just to see 2 years risk. And coming to the second one we're talking about today is your lipid profile. So when we talk about lipid profile, we're not just saying just checking the total level of your lipid in your body. No, we are considering which of the lipids, including low density lipoprotein, high density lipoprotein, and triglyceride. So when we are comparing them, when we are measuring the level in your blood, we are seeing what is your 10 years risk, what is your 5 years risk, what is your 2 years risk of having cardiovascular symptoms. Because when we are checking low density lipoprotein is kind of not good in our body. But when we talk about high density lipoprotein, it's the one that actually have a beneficial effect to our body. So when low density lipoprotein is very high, there is an issue there. There is definitely an issue there. So when we compare them, when we measure them, this lipid profile, when we assess them, we know what is our patient at risk of, what is going to happen if appropriate measure is not put in place for us to prevent the issue that's about to develop. So that's why we measure lipid profile. So as I said earlier, then when we're talking about lipid profile, we're talking about low density lipoprotein, high density lipoprotein, and triglyceride. Then moving forward, we'll also look at your blood pressure and the risk factors. So there are 3 risk factors I'll mention for us today. First of all, are you a smoker? Secondly, do you have family history? Thirdly, what is your cholesterol level? Going back to lipid profile. When we talk about cholesterol level, it gives us an idea what will happen in the next 10 years, in the next 5 years, in the next 2 years if appropriate measure is not put in place. So when we check your blood pressure and your blood pressure is giving us dun warning sign, we have to take action, and appropriate and wise action, just to prevent the risk of you coming back to us with heart attack or stroke already. So when we check your blood pressure and you are a smoker or you drink alcohol, my brother, because we're talking about and my daddy, we are talking about men's preventive health talk. There is actually a very big issue there that we are looking at, and we have to prevent it for long term future, for long term. So the thing is that we have to check to know, and also follow you up if you are a smoker and if you have a positive history of heart disease, or your father or your mother died of heart disease. Then we have to follow this up and see how far we can help you, so that we can prevent this we can prevent long-term problem, not for you to land on emergency and then we have to start doing chest compression. No one has strength for that, but then we have to do it until we are tired. And then that's on a lighter note. But then the point of this video is to tell you that checking your health is very important. Simple advice from Dr. G today, and a better you tomorrow, and a healthier you, and a happy you. Your family, your wife, your daughter, your son will be happy if you visit your doctor today. If you visit your doctor this week and tell them, this is how things has been. I need you to recommend the test that I need to do. So you don't just go to a practitioner and tell the practitioner what you want to do. He will assess you and know what is relevant for you to do. So see you next week, and see you next week. Always remember, this is Health Talk with Dr. G, and have a wonderful day.